In a recent episode of Joe Rogan's podcast, Green Bay Packers quarterback Aaron Rodgers opened up about how the popular podcaster and skeptic of the COVID vaccine helped him develop his own COVID-19 game plan. During his appearance, Rodgers said, "You helped me to be ready in case I did get COVID."
You helped me with a game plan to be ready in case I did get COVID, and I followed it to a T. And when I got COVID, within 36 hours, I was, symptom free and feeling amazing. But the protocols was you're off for 10 days. So I missed a game. We lost a football game. I came back, had to answer a ton of questions about it. Obviously had my, basically I lost, the majority of allies I thought I had in the media. The good thing is it drew a real line in the sand.
So the NFL MVP has been open about his anti-vaccine stance and faced backlash when he miscommunicated his vaccine status to the public. If I recall, some people thought he had implied that he was vaccinated, but what he actually said is that he was following, various protocols, which would have included, I think, protocols for if you are unvaccinated. And look, so he got, he felt better in a day and a half, as, some people do, maybe more people do if they are vaccinated. It's supposedly it makes your symptoms, for some people at least, have not as bad symptoms, or they ease up more quickly. And then for most illnesses, right, once you feel better, you're presumed to be not really contagious or at risk of anyone else. But at the time, we still had the 10-day thing in place, which was just going to make so much of life, missing 10 days of work or 10 days of school or 10 days of anything. It's way too much. So then eventually the guidance, I think, was drawn down to 5 days after that. So I don't know. What did you make of that interview?
I mean, I think you've been spot on about this from the beginning, but the minute it became clear that being vaccinated did not mean you couldn't spread the illness, it should have become nobody's business whether you had the vaccine or not. Nobody's business what you did with your body, especially for athletes, especially now that we know that they've been wildly underreporting any side effects from the vaccines. So I feel that, putting people in a position where they had to harm their careers, where they had to lie about something or misrepresent something just to carry on, I feel a little bit like that's on the regime. That's not on the person. And that did lead people to have these kind of, micro community. In this case, it was like one celebrity was able to reach out to another celebrity to get that game plan, right? Because they already had that connection, that network. But I think for a lot of just regular working people, people got fired over this stuff, and it's not okay. It's just not okay. And that thing where he said, I lost all my allies in the media, like that. Exactly. It's like, why is this anybody's business? How dare you judge somebody for what they've decided to do when we know, fine, when we thought that the vaccine was going to prevent the spread, yes, you could make the argument then, although even then I wouldn't have said you have the right to enforce this on somebody, but you could make the argument that there is a kind of like communal aspect to this. But the minute we knew that that was no longer the case, the discourse should have completely changed. And in fact, it didn't change at all. Yeah. That's very disturbing.
And also, do the allies that he lost in the media not understand that, like, different people are different, and it could very well be the case at the level of elite competition, like same thing with Novak Djokovic, that someone who is in the peak of their physical health, is not at a risk category for COVID, but might worry, which is not like, this is not anti-vaccine crankery or anything, but the way getting that vaccine could impact your body. Look, the vaccine itself has had, people have reported, we don't know exactly the statistics with how likely it is. Women have reported, some women have reported having their periods be less regular, things like that. You could have, there are unknown, unexplored side effect aspects of this, and I'm being very careful because I'm not saying that means it's a bad choice for most people, anything like that. But you could see someone who has such kind of peak physical health is very cautious about what they put in their body and how they train and what they do. It might be the case for that person that they narrowly have more to risk or will throw them off the way their body works from any kind of thing like this, it might be more of a concern for them than COVID. Maybe not, I don't know, but like that's their choice. That's something to talk about with their trainer or their doctor or whatever. It just doesn't affect me. It's not my business, doesn't have anything to do with me. I don't know what his health situation is or what his training plan is or what the risk might be either way for him. It's just not our business, and it's crazy that you would turn on someone for making some other calculation because it's not your business and it doesn't affect you.
And in fact, the motto, "My body, my choice," is so effective and worked so well for the women's movement for abortion rights, but was so quickly appropriated by the right that in Kansas, the Democrats told people going out to advocate for abortion rights not to use the language "my body, my choice" because it had been so successfully appropriated by the anti-mandate movement. You know, that concept is kind of, you know, baked into our Constitution. Our most basic, rights is like that I get to decide what happens to me when, it's just me. And in the case of abortion, there's actually another life there. Whereas here, it's literally just because we know that, the vaccines don't slow the spread. I'm with you. I'm not saying that they're not effective at, preventing serious illness, but they are not effective at slowing the spread, at preventing transmission, at which point it really does become, an individual choice. And it's so crazy that people can't respect that. And I just keep coming back to this idea that, the left, as soon as the lockdowns were over and there was, a vaccine available, they started to demand that people who were entertainers or wait staff or medical staff or pilots or cops, people who service them, be vaccinated so they could feel comfortable being serviced by these people. They felt that they had the right to then tell them how they should protect themselves, like there's something about that that's just very, to me, it's like very Marie Antoinette, like that sort of the status differential there and how that's operating. It's really troubling.
Indeed, well put. Well, we will have more Rising in just a minute. Stay tuned.